reshaping or rhinoplasty is a very commonly requested and performed cosmetic procedure. The procedure can change the appearance of the nose by altering its size, shape, projection from the face, or the contour of the nostrils. Rhinoplasty may be performed for purely cosmetic reasons or to correct some form of birth defect, which may make breathing uncomfortable. It is sometimes combined with chin reshaping to balance the face. The nose continues to change in shape until approximately the age of 15, and thus this surgery is rarely performed on anyone under this age. To understand how rhinoplasty works, one needs to understand the anatomy of the nose. The nose is made up of the nasal bones and cartilage. The septum, which is the wall made up of cartilage that divides the nose, has on each side a lateral cartilage and alar cartilages. The hump is made up of both bone and cartilage. For an open rhinoplasty, an incision is made in the columella skin that separates the nostrils. This allows the skin to be separated from the structure of the nose and adjustments made to the bone, cartilage and soft tissues. An open rhinoplasty will normally take approximately 1 to 2 hours and is typically performed under a general anesthetic. The area will be cleansed with antiseptic solution, and the area will normally be treated with local anesthetic solution after the general anesthetic has taken effect. Once the area has been prepared, a small incision made across the columella is then extended to the inside of the nostrils. This allows the surgeon to lift up the skin from the underlying nasal framework. Open rhinoplasty gives the surgeon an excellent view of the nasal structures. Depending on the shape of the nose and desired outcome, the surgeon may wish to trim the alar cartilages and use stitches to alter the position or shape of the alar cartilages to adjust their position. Any hump may be removed using a sharp instrument called an osteotome, followed by filing the area to produce a smoother and more elegant profile. Once the hump is removed, the nasal bones are weakened or broken to allow them to be brought together, which refines the nasal shape. The skin is replaced and the surgeon will close the incisions with stitches. Some surgeons will insert a device called a splint into the nostrils temporarily to support the inside of the nose. Adhesive tape such as steri-strips will control swelling, and you will normally also have some form of splint over the nose in order to provide comfort and stability. Commonly these splints are made up of plaster but may also be composed of other materials. Following a rhinoplasty, it is normal to expect some discomfort, swelling and bruising, which commonly affects the upper face and around the eyes. The initial bruising begins to settle after a few days and has usually mostly gone in 7 to 10 days, and you will see the improved contour and shape of your nose at this time, although some swelling may persist for a few months. Normal light activity can begin almost straight away, but strenuous activity should be avoided initially. Rhinoplasty will refine the shape, size and contour of your nose. The final results may not be fully visible for several months, but are very long-lasting and will significantly boost your self-confidence. The majority of people who have a rhinoplasty do not suffer any untoward side effects and are very pleased with the results, but it is important to realize that no surgery is totally risk-free. There is a small risk of infection or bleeding. There may be significant bruising and swelling. Undercorrection or overcorrection of your nose may require further surgery.